Imagine you are trapped in a place where you're separated from your family, your life, behind closed doors that can quickly become a place akin to hell. One that if you make one small mistake, that could mean your life. The corrections officers are supposedly there to help with the process of rehabilitating and giving the tools and resources to inmates to become better for themselves, their family, and their communities. But sadly, the institutions in which we entrust and depend on to make sure that these so-called criminals and violent people, the dregs of society, are turning them into a productive and functioning contributors to society, are the very ones who manipulate and abuse their authority. Do you honestly think that this so-called system is actually working? Because I, along with hundreds of thousands of others, know that it is not. We know that the people placed in positions to make or break an inmate's chances at good programs or treatments are the ones placing them in institutions that will benefit their incarceration, are also the ones who control what happens to an individual based off an emotion that they're unprofessionally bringing to their jobs. To them, they make it personal. And that's not only corrupt, it's evil. These men and women are hired to be the ones who keep the peace and maintain order, when in reality, nearly all prison riots or protests are because of the way these guards treat the inmates. The way they make these men and women live, the poor quality of food they eat, the lack of proper medical care and mental illness treatments is because that's all decided by internal prison employees. These private companies say to the public, we're going to make it cheaper for families to talk to inmates. We're going to lower the cost of incarceration. When in reality, all they have done is put hidden costs and fees onto inmates who make anywhere from 13 to 32 cents an hour, and that's one of the highest wages in the country. Some states don't even pay a wage for their labor. They're legal slaves. Inmates are also responsible for any medical or dental costs or incarceration costs. On a copay, that is even if they're given the chance to even see a doctor. There has been a string of deaths in Washington state related to lack of health care and the low access to medical care and negligent actions taken by COs when an inmate is dying. Not so shockingly, the leading cause of inmate deaths in jails and especially prisons is the lack of proper medical care or medication for treatable diseases like heart disease. Suicide would be the next highest rate, then it would be murder, and then the rest is labeled unknown. In many cases, autopsies aren't performed. In nearly all cases, they refuse to have one done. Why spend the money when they know they're dead? This is more true for inmates who don't have any close relatives to claim the body and pay the expenses. Many inmates died due to medical problems not being treated because either the DOC's medical staff voted it's an unneeded expense, even going against outside specialist doctors' recommended treatment. The biggest threats to inmates isn't other inmates, it's the guards and staff. Governor Inslee, in one of his recent state addresses about the DOC and the steps they're taking, in a very assuming tone, made the statement that inmates are safer in prison than out here, when in reality, the likelihood of inmates contracting a virus or the influenza is 10 times higher than that of any of us in normal population. I think Governor Inslee needs to double-check his sources or at least make it a lie that's not so easily disproven. We must stop pretending that these problems don't exist. If we're supposed to trust in the politicians and policymakers who promise a better level of care and treatment, is year after year diminishing rather than improving, regardless of the new numbers of committees or groups created to oversee that the policies are met. Instead, they're met with incentives around $93,000 worth a year. None would say, yeah, what we're doing isn't helping, and give that up. Who's going to report fellow staff negligence and possibly lose their salaries? Evil happens when good people fail to act and stay silent. The DOC is awash. The number of inmate deaths should shock and appall anyone who has any respect for human life. Everyone needs to stand behind us and those inmates who aren't begging for special treatment and know this isn't a get-out-of-jail-free card. We want these systems and officials to be held accountable for their actions. All of us must answer for our choices every day. Why shouldn't they? The way they run our states and internal systems is feeling more Orwellian with every day that passes. This virus doesn't favor poor over rich. It's an enemy with nowhere to drop bombs and nowhere to aim. There's no treatment or pills for a cure, and they continue to just lie to us. I guess we better start praying to God, because we certainly can't rely on their science.
The story you are about to hear is true. Only the names have been changed. Only the names have been changed. Here story you are about to hear is true. Only the names have been changed. Only the names have been changed. Here. Only the names have been changed. The story you are about to hear is true. Only the names have been changed. Only the names have been changed. Here. Only the names have been changed. The story you are about to hear is true. Only the names have been changed.